One of the things you talked about was the use of language, and I'm conscious of our audience, GPs, working busy practices, and the importance of language. I'm interested to hear more about that in terms of how, people obviously want to get it right. And I'm wondering, from your experience, from having been in an acute setting right through into the community, what advice, what suggestions, what was a good experience that you think would be good to share and to pass on to clinicians?
I think in situation, I know it's rare, we're talking transferable across all strokes, but I think very good experience is actually what a lot of the nursing staff did. A lot of them would look into my eyes, for example, and look for the non-verbal cues, and try and be. So, for example, also if they said they were going to do something, I have to tell you this. Quite often in rehab, I had to learn to live without a catheter, so I had to be flip-flowed. Now, I couldn't use a flip flow. I couldn't possibly do it, so it would require a nurse to come and flip my flow. Now it was 20 minutes, then it was 40, then it was an hour, and he built up to 4 hours, and they take the catheter out. Well, if nurse didn't come back at 20 minutes, an hour, 4 hours, whatever, you would bypass. And the indignity of that is phenomenal. And actually, the point I'm trying to make is that I think as professionals, we are very obvious that we're going to be rushed off to do this emergency, that emergency, or this or that. And actually what they said they promised to do, they can't physically do. And instead of leaving the patient, whether it's an older patient who's perhaps from a background where they wouldn't complain, not like myself, they would accept that. But I do think medical people need to understand that it's not a sign of weakness that you said you'd do something and you can't, so you don't own up to it. It's to go back to, look, I said I'd be here at past to do this, that and the other. I can't do it because of this, that and the other, but I will be back by such and such a time. And it's just respect, just dignity. To give someone some dignity is very, very easy. It's not rocket science. It's treat people like you would want to be treated. It's just a bit of information. It doesn't matter if you're late, just explain it.
Because we'll all be patients at some stage ourselves.
Exactly.
Yeah. And I suppose particularly, and certainly my experience in the National Rehab Hospital, is the importance of reliability for the patient, particularly when you don't have control.
And actually, again, with your background, it's very scary because you probably really psychoanalyse me. Yeah. I'm worried now. No, I forgot what I was going to say.
We're talking about the reliability and the...
Yeah, and you picked up on it on the car earlier that, I have seriously bad OCD at the moment about travelling. And it's that I honestly believe it wasn't this bad before by any stretch of the imagination, but there were so many times where I was let down. And, doing things when you say it drives my husband mad because you say you're going to do it. Well, he often doesn't. And so I try and get people to put their own time limits on when they're going to do something, but I've been left with this as a result of it.